Landon. It's good to meet you.
Hi, nice to meet you.
How are you doing today?
My neck's just been really bothering me, and I guess I'm doing okay because I'm here, but yeah, my neck's been really bad. So.
Okay. Have you seen a doctor about your neck yet?
Yeah, I went in and saw the doctor. They took images, they did an MRI actually, and I have degenerative disc disease, but he still said to come to PT, so I don't know if, at this point, like, I'm so young, and I just didn't think that, like, degenerative disc disease, it sounds kind of bad, and my neck just hurts all the time, and I don't really know what you can do for it, but...
Okay, do you know about how long it's been going on?
A long time now. It just keeps coming and going, coming and going.
Okay. Were you in an accident or anything like that?
No, it just kind of developed to just... it's just the disc disease, you know?
Mm-hmm.
Like, it just progressed, I guess.
Okay. Well, I have good news for you. So, degenerative disc disease is actually normal. So, most people's discs between their spine actually get smaller as we get older. That's very normal. So, what you're experiencing is probably normal, and it's not really a very important thing to focus on in your pain. It's probably not contributing to your pain very much, but there might be a couple other things. Maybe you don't remember a particular incident, but are you stressed out a lot at home?
Yeah, but, like, how could my degenerative disc disease not be causing my pain? Like, this MRI said I had it, and it's super painful.
So if you look at MRIs of a lot of other 25-year-olds like yourself, you probably would see something similar. It's probably not that big of a difference. But sometimes, so if you were experiencing neck pain before and then you were given this diagnosis a few years later, there might be something else going on. So we have kind of an alarm system in our body. So what do you think happens when you step on a nail?
I would pull away from the nail.
Okay.
And it would hurt.
So when you step on that nail, your body's alarm system gets set off. Mm-hmm. It says that there's danger. It perceives the nail as danger, and that goes all the way up to your spinal cord, to your brain, and your brain perceives that as pain to tell you that you should step off of the nail. Mm-hmm. And if it's in your foot, then take it out of your foot. But sometimes, in about 1 in 4 people, you experience just a phenomenon where the alarm it shuts off, but it's a lot easier to spike it again. Mm-hmm. Does that make any sense?
Yeah, kind of, but just always kind of in pain, and I don't know, so, like, if it's not my degenerative disc, like, what's wrong with me?
So,
like, is my brain wrong? Is something wrong with my brain?
No, nothing's wrong with your brain. It's called sensitization, so your body's just become used to being extra sensitive instead of what we might consider a normal amount of sensitization. So most people, you can touch their hand and it won't be painful, but sometimes if somebody has an injury to their hand and you touch their hand, even if you're not doing any tissue damage, it's painful to them because their brain gets a little mixed up since the alarm is a lot easier to set off. And so with your neck, you're probably not actually causing any damage. No tissue is being damaged in your neck, and the bone's not being damaged either when you move it or when you touch it. But your brain has just set its alarm system a little bit higher, and we can do a couple things to lower that alarm system. Let's see, can you think of anything that's happened to you since your neck pain started? So anything at home or work?
Like, nothing bad has happened, but I'm just really stressed. Like, work picked up a lot, and I'm at home. I live with, my grandmother lives with me, and so I'm taking care of her a lot, and so I have a lot going on, so that's why I'm, like, here to try to get rid of the pain, and that's why I went to the doctor, because I'm constantly trying to do things, and my neck's hurting, and, it's like, I just don't know what to do anymore, or is this just my life? Am I resigned to this? I don't know.
I don't think you're resigned to this at all. I think that some of the reasons that your pain has persisted for so long and that the alarm system is set to be so easily set off is that you're stressed out all the time and you're really tense, and sometimes when we tense up, things get a little sore. And so I think that if either you and me, or maybe you and another healthcare professional, work on taking some of the stress out of your life and working on managing those types of physical and emotional and mental stresses, then we can help get your neck pain under control again. Would you like to see anybody outside of physical therapy for your stress and anxiety?
I mean, I could, I guess, like, if that's what you think I need, but, like, do I even need to see you? Like, is PT, like, can PT even help me? Or should I go see somebody else?
No, PT can help you. I think today we'll start off by doing some visual imagery exercises, and we'll see how that goes, and then I'll have you come back at least one more time, and then we'll go from there. How does that sound?
I mean, I'll try it. I just want the pain to go away, but I don't really know if it's going to work.
It'll take time, but I think we can help you out. I think we can at least decrease your pain.
Okay.
All right?
Yeah, that's all I want.
All right, sounds good. Now I'll have you lay back on the table, and we'll get started.